So, hello everybody, my name is Nash. I'm from group 26. So in this video, I will demonstrate how to perform care for tracheostomy. In this video, I will also include how to change the dressings and also change the cannula. So, that being said, let's get into it. So, in this demonstration, I won't be using any people or any pillow. Instead, I actually came up with this kind of thing. I made it myself. It's not perfect, but it's a lot easier for me to explain using this one. So as you can see, there's actually a box, the white box. The white box will be the patient's throat, and you see the tissue here. It's not white though, it's just a tissue. Okay, so the tissue here is actually the dressings and there's another cardboard thing with the one with which has the straps to it. This will be the facial plate. Now, in real life, facial plates actually have numberings on it. But for me, I actually wrote the DCT here. If I'm not mistaken, the DCT actually stands for Disposable Inner Cannula, if I'm not mistaken. And there's also the size, the diameter of the inner cannula and also outer cannula. But I'm not going to get into details of all that. Also, in this one, the one that has the bottle cap, this is actually the one that has the bottle cap and attached to a translucent tube. This will be the inner cannula, while the straw with the white straw with the green stripe, this will be the outer cannula. So with that that being said, let's get started. So in the care of tracheostomy, there's actually a kit, a tracheostomy kit, if I'm not mistaken. So this kit is used to help changing the inner cannula or changing the dressing for the patient that has the device attached with them. I do not have it with me, so I came up with mine. It's not perfect, but it's what I have, so please accept it. So inside, there are actually a lot of equipments attached with it. There's the sterile glove, there's the hydrogen peroxide or saline solution. There's also the equipments used like brushes and etc. to clean the cannula. There's also drape and also dressings and cannula. But at the moment, I will just explain it briefly. So the first step to do is when you want to care for tracheostomy, you have to prepare the kit first. So now, before we begin, the first thing that you have to do is wash your hand. Okay, after you wash your hand, you also have to clean the surface. Alright, use alcohol-based disinfectant to make it even more effective. So after you finish that, remember your hands are already clean. Don't try to make it dirty by touching different places, alright? So prepare the kit that you have. This is the one that I made myself. It's not perfect, but it's what I have. So when you want to open the kit, make sure that you open it away from you. Alright, away from you. As you can see, the equipments are well prepared inside. Now, remember, everything inside here is sterile. So do not touch anything except for the gloves first. Even the gloves are sterile, which I will demonstrate how to wear sterile gloves properly afterwards. So as you can see, I'm actually using gloves made out of plastic. This is because I do not have gloves that made out of latex. So I really hope that I can use this one. So the first thing that you need to understand is how to put on a sterile gloves. Normally inside this kit, they already included inside it. What makes sterile gloves different is demonstration purpose. I'll be touching inside. So what makes sterile glove different is the fact that you can actually find that there's part of it that has been folded. Primarily the part which is where the wrist is located. I know it's huge, it's not my size, it's plastic, but let's just use it at the moment, alright? So this folded part is where the internal side of the gloves has been exposed externally. So when you want to put on sterile gloves, you have to hold it from the one that has been folded. Not from here, nowhere. You must not touch it. Let's say this is the sterile glove and I want to wear the sterile glove. Hold it with the part that has been folded. Alright, let's say this is the kit. I want to put on my sterile gloves. Hold it with the place which has been folded. Not here, but here. It's a little bit difficult because this is translucent. So, after you hold it, you put your hands into it. I am still not touching different parts, still the same part. Alright, after you finish that, you can pick up on the other one. You don't have to be worried because you follow the procedure, so your gloves is still sterile. The other places are still sterile, so you can just pick that up. You can just pick it up. So let's imagine that we finished, we put on our gloves. Now the next thing to do is basically to lay out your equipment. So normally there is a drape that is included. What you have to do is take out the drape and place it on your table. I do not have a drape unfortunately, so I'm using a pillowcase. So don't judge me. By the way, the strip are also sterile, right? It's supposed to look like a square, but mine is a rectangular because I do not have a proper drape. And also, very important reminder, the drape is not as thick as the one that you see here because this is a pillowcase. The drape are actually very thin. So sometimes when people lay out their drape, they'll end up in this situation where some parts are actually folded like this one. So remember, if something like this happens, do not fix it. Okay, this is wrong because the moment when the drape touched the table, we considered it as non-sterile anymore. It's not sterile anymore. I'm sorry. So if something happens like this, leave it. Do not change it. So, by the way, I forgot to mention, inside a tracheostomy care kit, there's actually a lot of compartments. Like there's some walls that separate different parts of the interior of the kit. Let's just imagine that there are some of it. So some of the equipment that are included, again, mine is not complete. It's like hydrogen peroxide or saline solution. Also like the cleaning kit. I do not have, I just use a cotton buds. Some even include brushes. Even inner cannula are also included, dressing and etc. So after you lay out all your equipment, you can proceed to your patient. So imagine that this is the patient, right? This is the patient. Also pretend that my hands are still sterile. I did not touch anything. Okay, when you are ready, remind yourself which hand is dominant and which one is not. For me, I'm right-handed, so my right hand is my dominant hand. That means my left hand will be the one that will not be sterile. So what does it mean to remain your dominant hand sterile? So for me, I use my right hand. So my left hand will be the one that will be used to physically remove the cannula. So this one is the inner cannula. The straw underneath, this is the outer cannula. So you have to remove the inner cannula. Also, I forgot to mention, a cannula is not supposed to be this straight. It's supposed to be like a hook shape, like all the way there. But I'm using straws, so just accept it, alright? Okay, after you have removed the after you have removed the cannula, inner cannula, the inner part must remain sterile. Even though your right hand is sterile, my right hand is sterile, I should not touch it. It has to remain like this. So this is, let's say this patient is using a disposable cannula. So from this disposable cannula, I can remove it, dispose it properly. And then I can reach out to a new cannula inside the kit. Let's say the kit is for disposable cannula. So again, the same hand, I place it into the outer cannula. I'm using a straw. So push it slowly and firmly. This is how you change the cannula. Now imagine if the patient is using reusable cannula. So what you have to do is the same procedure. Remove the cannula with your left hand if you're right-handed. The same hand, do not change it. So with the cannula that I took from the patient, I place it into the container. Inside the container there's saline solution. If not, there could be hydrogen peroxide. So use a brush. With a brush, normally it is included in the kit, so you don't have to worry about it. So you dip the brush into the saline solution or hydrogen peroxide, and you begin to clean it by pushing it into the tube, into the cannula. Now mine doesn't fit, right? It does not fit. So in reality, it's actually a lot bigger than this one. So once you inserted it, twist it and push it all the way through. So it will remove any mucus that are present inside. So imagine I'm cleaning it. After I use this one, I dispose it. And I take a new one, clean it inside again, all the way through. Now that I've cleaned the cannula, the inner cannula, I can insert it back into the patient. So this is the patient. Remember, the same hand. I'm not touching the tube. I'm not touching this part. It remains sterile. And then insert it into the outer cannula. All right. So this is how you clean the cannula. So what about changing the dressing? So changing the dressing could be a little bit complicated. You, as a matter of fact, need help from another nurse. So one nurse will be holding the cannula and also the plate, while the other nurse will be removing the dressing. So theoretically, one nurse will be holding it here. Actually, the inner cannula has to be removed, so they will be holding on the outer cannula. The outer cannula with the face plate. Well, the other nurse will actually detach the strap. They will remove the strap and also the dressing. Remove the cannula. Remove the cannula. You can soak it into saline, or you can clean it if it's reusable. Clean it in saline solution, or you can soak it inside it. And then afterwards, after you've removed the inner cannula, you actually have to perform a suctioning procedure to clean the outer cannula. Now, I know the video is already long, so unfortunately I cannot include it inside this video. So let's just continue with the changing of dressing. So one nurse will actually be holding it here, while the other nurse will remove this strap and remove the dressing. Unfortunately, my strap is not something that I can remove easily. So I cannot. The faceplate will remain here, including this strap. But in reality, you can actually detach the strap. So the nurse will hold it here, while the other one will remove the strap. Now imagine that the strap have been removed. After you have removed the strap, you have to pull the dressing out. And this is the beauty about this dressing. The dressing shape is very unique because they actually have a hole in the middle. This is for the stomach, and also like a cut there. You see there? This is because it is to allow you for easy changing. You know, you can just slip it in. Also, you can slip it out. So back where I was at. Okay, so after you pull the dressing out, this is a time where you can actually check the interior of the dressing. Say if there's any changes, any increase in discharge, remember it and record it later in the diary. So you can dispose this one already if it's dirty, if it's soiled. And then also you should also take a cleaning equipment. Make sure it is dipped in saline solution or hydrogen peroxide or generally a disinfectant. And then start placing it underneath the plate, cleaning the stoma and pushing out any dirt, any blood, any mucus that are present there. Do it on both sides, on the upper and also on the lower side. After you've done cleaning, change your glove. Dispose your glove. Use a new sterile glove. Take a new dressing, place it underneath the plate. Again, I'm doing this by myself and the strap is still here, so it will not be perfect. So start pushing it inside. Okay, you know what? This is very difficult using a plastic glove, so I'm going to remove it. I remove my glove because I'm using plastic. It's difficult. You're supposed to use latex. So now that the dressing is in place, you've cleaned the stoma. You also clean the inner cannula. Now what you have to do is you take back the cannula. Wear gloves, guy, please. I'm using plastic. Please forgive me. So you insert it back into the outer cannula. Oh my god, this is so bad. Okay, so this is the inner cannula. Insert it inside. See, it's already inside. So you've completed changing the dressing and also changing the inner cannula. So that's all for the video, guys. Alright, ciao.